Assalamu alaikum dear student, this is the second part of the hypertrophy video in the general pathology. And you know that there is the mechanical receptor. When there is any stress on the heart, the mechanical receptor respond signal transduction, which increase the transcription, and transcription increase the certain type of proteins. For example, increase in the contractile protein. So there is increase in the contractile protein. And the other one, there is if the mechanical stress on the heart or the alpha adrenergic agonist, whichever there is any stress, so there is an increased production of the ANF. What is the ANF? ANF is the arterial natriuretic factor or a arterial natriuretic peptide, which is only released in the blood when there is any kind of stress applied on the heart. And what is the function of the insulin like growth factor 1? It also causes the transcription. It makes certain growth factors. Okay, growth factors. What are the function of these growth factors? These growth factors go again and bind to this receptor, and whenever insulin like growth factor bind to it, cause transcription of the protein, and then the translation produce that protein which are contractile, or they produce arterial natriuretic peptide or factor, and they produce also the growth factors. What they do, they go and bind again to this receptor because there is stress going on. And if there is hypersecretion of the insulin like growth factor, or a person taking this factor from outside, then there is a very heavy chance for the hypertrophy of the myocardial cell. Okay, then there is alpha adrenergic agonist or the drugs which also use it for chronic persons, which a person use for chronic time. It also cause hypertrophy of the heart. And there is the mechanical, any kind of stress, for example there is increase in the blood hemodynamic overload, or any other condition, hypertension, wall defect, it increases the stress on the heart. So when it increases stress on the heart, then there is increased transcription and contractile protein increase, ANF increase, and growth factor which also do the same cycle, these all increase. And all the function of these, when heart is applied, when stress is applied on the heart, there is the increase mechanical performance force, increase mechanical force of the heart to pump more blood out of the aorta and to which go to the body and perfuse there. So this is the basic cell and the receptor, how they work and how they increase the mechanical force.